Alright, so today we're going to go over how to apply a CPM. We'll kind of go in sequence as to actually performing the whole entire task itself. So normally to initiate the whole CPM process, you'll get a page, you'll call them back at that number they specify, and you'll ask them multiple questions. Some of the questions will be, what is the patient's VIN number? What's the patient's name? What bay number are they in? As well as, are they in a regular floor bed? If they're not in a regular floor bed, you cannot apply the CPM. There's all sorts of different gurneys, other devices that a patient can be in where there's no footboard to properly secure the CPM itself. So you want to get all that information first. Then what you can do is go to the computer, look up that information if you're able to. If not, you want to contact one of the therapists to make sure that you're sure as to what settings to have. So how much degrees of flexion, extension, the speed, as well as to which leg you're applying the CPM to. So once you have all the information, you'll want to go and get your CPM cart. And you'll typically have 2 on there just in case you need to you find another patient down there, or it's a bilateral total knee replacement. So once you have all this information, your information about the patient, you have your CPMs, you'll want to go ahead and go down to our PACU location, post-anesthesia care unit, and then you'll typically, there's a button on the wall, all you need to do is hit that button and the double doors will open for you. Rare times will there ever be a code that needs to be placed in. If that is an issue, please let one of the therapists know. Once you arrive at the patient's bedside, what you'll want to do is get things ready. So you want to make sure that if the nurse can help you out, the nurse can help you out, or if you need to bring somebody with you, or if you're early on your training, you may need one of the therapists to come with you to check you off on this skill. Probably what you'll want to do as well is get a couple of towels, regular towels, as well as some blankets as well to help secure the CPM in place. This also helps to cover some areas to make sure there's no skin breakdown that occurs. So what you want to do once you arrive at bedside is you want to introduce yourself to the patient. Hello, my name is, insert your name here. Then what you want to do is make sure you place the proper settings on the computer itself attached to the end part of the CPM. So it'll be secured in place. So what we can do is we can take it out from the little station it's got here. You want to make sure it's on. You want, if it's not turning on, you want to make sure you check all your connections. So where it inserts into the CPM itself, and make sure it's plugged in as well. So typically here you've got your this adjusts how much extension you have. This adjusts how much flexion you have. So straightening of your knee, bending of your knee. Our up and down arrows to adjust. Our start and stop buttons. Our speed as well to adjust the speed. All these other buttons you do not need to worry about. So when you're adjusting how straight the knee is, you're just going to click on the button once. You don't need to hold it, just press it once, and it's going to start to flash. And then what you want to do is either adjust it up or down depending on what the settings need to be. If you want to adjust the bending, you want to click the other one, and so you'll see 45 flashing. You can either adjust it down or adjust it up based on the physician requirements. After that, what we'll want to do is we'll adjust the speed as well. So the speed button here, just like the other buttons, we're just going to click once, and the speed goes between 1 to 5, and this is how many times it goes through its cycle per minute. So right now we're at 5. We want to bring it down to our medium speed, so it goes through 3 cycles per minute. So everything's all set for this, so we're ready to place the CPM on. Alright, so when applying the CPM, what you want to do is make sure you bring yourself in close enough where you're able to transfer the CPM onto the patient's bed. This bed, as you can see, is not set up for a CPM to be applied. There's no footboard. So when you come in, you're going to want to notice a whole bunch of things. Okay, is the lower half of the bed where the patient's knee bends, is that flat? As you can see right here, her knees, the knee part is not flat, so we need to flatten that before we progress even further, or any further. And what you want to do as well, once you get it down all the way flat in the lower part of the bed, is you want to make sure you lock that out. So there's a little green button over here, which allows you to access all the other options on the bed here. You want to push the green button, and that allows you to activate or adjust your different settings here. But what you want to do is you want to hold the button and then make your selection. So now we can't move the knee part anywhere. You also want to make sure that the patient's not too flexed at their hips, otherwise this makes applying the CPM a little bit more difficult. So where Chelsea's at right now, that's a little bit too high. I'm going to bring her back down a little bit more. And patients may ask you if they can sit up a little bit higher. Unfortunately, once the CPM is applied, we can no longer adjust the height of the bed. We want to make sure, I would say roughly you're at about 10 to 15 degrees of the bed being up. And you can actually see that by a little measuring tool right down here. So I'm going to come in and introduce myself. Chelsea, my name is Dave. I'm one of the physical therapists here. You're going to introduce yourself as, hello, my name is Chelsea. I'm one of the physical therapy techs here. I'm here to apply CPM onto whatever knee. Okay, you'll have a lot of patients who are really out of it from medications, or they may be able to lift their leg because they're ready to go. So sometimes you may need to borrow the nurse to kind of help you out if they're really out of it. If not, I can show you some strategies in order to help place a CPM. So it helps to not have the CPM plugged in when you're placing it. You want to bring it all the way over. And if you're placing it on the left leg, you want to place the cord running underneath the CPM. If you're placing it on the right leg, just based on where the plug is here, there's no issue with the plug location. So there's little knobs down here to adjust the length. There's knobs right here to adjust the foot part, as well as there are knobs right up here to also adjust different positions of the knee and length of the device. So one of the things that you can do if you're on your own and you don't have any help from anybody is what you can do is use your hand and you're just going to kind of scoop on the inside part of their leg to help lift them up. What really helps is making sure you get the top part underneath their leg first, because then from there it makes it a lot easier. So I'm just going to kind of scoop underneath and I'm going to lift up. You're helping. And I'm just going to kind of place it just like that. The patient's in no danger right here. This just kind of gives me some time to kind of move things around to make sure I get this device in the right position. And kind of keep scooting, scoot the device over. And I'm going to need to make sure I match up where the knee bends with our actual access right here. So this is our access where you have this green part here. And in order to find where the knee bends, typically what I do, it's hard to palpate the certain bony features sometimes. So what you want to do is use your fingers on the backside part of the knee and you're just going to kind of lift up. And where you feel a crease develop is where that knee joint is. And that's that line you want to match it up with. So I can even use my hand underneath, or you can use kind of somebody else to help you out. I'm going to notice where their joint is as compared to the joint of the machine. So with this, I need to move her leg up about 6, 7, 8 inches or so. So all I'm going to do is lift up, and I'm going to keep this front top part down up here. Make sure it's underneath the patient. We're going to scoot it up. And we're going to reassess, see where we're at. So again, underneath the patient's knee, figuring out where that crease develops. And we're still a little bit short, so what we need to do is kind of increase our length here as well. These help adjust the ankle. And you also have ones up here that help either to flatten it or extend other things related to this, which are not primarily used. The primary two that you're going to use are these two here. Looks like we're good. So making sure that we're lined up with the patient's knee joint along with the access of the CPM itself. So with this as well, we want to make sure the length is abutted right up against the patient's foot. And everybody has a different style with the way they modify the ankle part. I like a neutral position. However, you have other therapists who like a slightly plantar flex aspect. Not very many people go with a dorsiflex position. So make sure everything's tight and secure. So on the top parts here, you have little metal bars that could cause skin breakdown. And this is where your towels are going to come into effect. Is you're going to unfold your towels. You're going to kind of cover the top part here and just kind of bring them along on the inside. We're going to do the same thing on the inside part of the patient as well. Can you go ahead and bring your leg out a little bit? There we go. So same thing, sometimes you'll see it already uncovered, and so you can see it's already pushing into her leg. We'll make sure that we don't have anything else going on. Our primary concern is making sure we just take care of this knee, that we have nothing else happen, because if we start having skin breakdown on top of this, is another aspect the patient could stay longer in the hospital. So we're just going to unfold our towel. Right in the crease there. And you have some buttons here that could also cause skin breakdown, so you want to make sure you cover those as well so it's not rubbing on the other leg. So what I'm going to do as well is make sure our device is stable as well, laterally. So I'm just going to fold some towels. I'm just going to place, you've got some bars here on the outside and the inside. To help stabilize this device a little bit more. So normally when you have a regular floor bed, you're going to have a baseboard, and what you're going to want to do is bring the baseboard close enough where it butts up against the end of this. If it's difficult, sometimes you can take the baseboard off, but you need to leave some room to put the baseboard back on. That in the case where a patient may be really tall, so they're pretty lengthy in bed. There's also a feature on this bed that allows you to bring the end of the bed down and then also up as well. So if I were adjusting that device, all I'm going to do is click the green button here, and then I'm going to retract the baseboard. And also as well, if you're having difficulty, if you've already gone up as high as you can go with the baseboard and you still have room left over, what you can do is take some thicker blankets, place them between here and the baseboard, and then bring it up as high as you can, make sure that that's keeping the CPM in place. So we're going to bring our Velcro around her foot, keep that in place. So we also have our cord as well. We're going to run up towards the head of the bed, and you're going to always want to place the side, once you have the CPM, you're going to want to bring up the side rail on that side. If we put up all three side rails, that's technically a restraint. So we're just going to bring our cord up all the way along the inside part of the bed. Also helps keep things in place so that we have less tripping hazards. You're just going to plug it in at the head of the bed here. And our PACU unit, you're going to have a whole line of spots to plug in this cord. So then what we're going to want to do, we have it secure at the end here. We have it in place. We have it in the right spot on our knee. We have it secured. So now we're going to want to start to run it. So what we're going to do is we're going to watch the patient's reaction as we turn the device on. So I'm going to hit start, and it's going to slowly start bending that knee. So at 20 degrees right now. 30 degrees. 40 and 45. So if the patient's not having an adverse reaction to this, we have now placed the CPM properly. However, if the patient is having severe pain, you're unable to get the CPM to go through its full range of motion, you're going to want to contact a physical therapist as soon as possible. It's the therapist's duty as well to make sure we have the CPM on, but also at the same time make sure it's through an adequate range of motion that the patient can tolerate. There's different aspects that you may see on this device. If it says maintenance needed, we'd like you to not use that one so we can pull that out to figure out why we need to do some maintenance on it. There's other ones that will say a warm-up feature. I don't know how, we don't really know how to turn that part off, but it'll just kind of bring them up slowly and surely into that total range of motion. There's ways to bypass it that we can cover with you as well. There's also situations where we have a bilateral total knee replacement that has been performed. In that position, what you're going to do is you're going to have one CPM on each side. Typically, you'll have to kind of bring their legs out a little bit more to allow for the space needed for those devices. And what you're going to do when you turn those on is you're going to bring one up at a time. Once that one gets all the way up, you're going to allow that one to start coming back down. You're going to turn the other one on. So it's what we call kind of a running man. So each one's alternating. And also with those, you want to make sure that you do adequate padding between the two to make sure that the two don't all of a sudden catch each other and then throw each other out of position. So when you're covering mobility camp, occasionally you have to take these CPMs off. What you want to do is you want to make sure that the CPM is completely flat. So I've stopped it at 0. And when it's going up and down, this number will change. But right now it's flat at 0. So we've got that taken care of. What we're going to do is we're going to unplug the CPM. I'm going to unstrap my patient. Make sure we got everything out of the way. And what I'm going to do is I'm going to help bring the patient's leg up. So we're going to go bottom part out first, and then you bring the top part out. And move it off to the side.
Cool.
And if you guys have any questions, feel free to ask any one of us. Everybody's got a different style what they apply CPM. So if you hear something different, it's just it's not exact science with these things. Everybody's got a different style for them, and they all work. None of them are bad. They all work. So once you're done placing the CPM on the patient in our PACU unit, you're going to fill out your CPM slip. So you're going to place what leg you applied it to, the degrees of extension, the degrees of flexion, the assigned therapist to that floor. You'll also want to grab a patient sticker to place on that as well, so we can put that into the patient's chart to follow up with the patient once they get to the floor. Then there's also the CPM book. This is a book that is kept down in our department. You're going to want to keep an extra sticker as well, so you need a total of 2 stickers, one for the slip, the other one for the book. The book, what you'll do is you'll go down to the department, you'll put it in there, you're going to select whatever CPM device you have. So our CPM device here is S21, and we're using one soft good. And we'll show you the book as well as how to fill it out during your training. If you have any questions, feel free to let us know. Thank you.